This is the Neurosurgery Podcast.
Welcome to the Neurosurgery Podcast. This is another exciting virtual recording, and I've been waiting for this. I know I previewed it a little bit, JP, on our last recording, but we are talking to the author of this book, Gray Matters. And Ted's been on the podcast before. Ted, you want to say hello?
Hey guys, how's it going?
Great to see you. This is super exciting. We could record you for hours talking about Gray Matters. Um, it is a very, very good read. Um, I had the chance to go over it, and I got to tell you, so exciting. Can you start out by telling us a little about the inspiration for this book?
Absolutely. So, what I wanted to do with this book was to try to tell our story to the general public because I really had a sense that people do not know what we do as, I'll say, brain surgeons, and Mike, forgive me, because it really is focused on brain surgery. You'll write the book on spine surgery. I look forward to reading it, but I'm going to talk about brain surgery. And I really felt I would talk to friends of mine at, cocktail parties or on the sidelines of games and try to kind of explain what we did. And most people just really don't have a clue. Even our wives and our kids don't really know. And I wanted to write a book that, I could hand to somebody that I knew and they could read it and really get a window into the intensity and the dedication, the focus, the sacrifice, what it's like to have someone else's life in your hands or their functionality in your hands, as you know that we often do, their vision, their movement, what that responsibility is like, and also some of the stories that we all know. Like, we tell stories, we know these neurosurgical stories, but the general public doesn't know them, and we have access to a lot of information that is interesting to them. And so the hard part was trying to make it relatable, right? To make it a book that not only was relatable to the general public, but that neurosurgeons would also enjoy reading at the same time. That was really the hard part. Like, I had this fantasy that it would be a book that, JP could be reading, and I don't know if you're married, JP, or your wife or your significant other, or your whoever you're dating at the time, or
Yeah.
Mike and your wife, you'd be in bed together, both reading the same book, and each would get different something out of it, but both enjoy it for different reasons. So that was kind of the goal.
That's a very unique goal, which is probably why this book comes across as such a unique offering from not just a neurosurgeon, but a physician or a surgeon in general. Because we've all read the popular books about neurosurgery, many of which are, as you said, more written for the practitioner. But having read through this book, I think you hit the mark on that one because it is something that I could imagine reading about a field I'm not a part of, and the stories are inherently interesting, and the way you tell them it's very accessible to someone who, at least I try to imagine, if I didn't know what you were talking about from firsthand experience, it reads very accessibly. When I was going through the book, I kind of noticed an overall arc toward the structure of the book where it's not too complicated. You look towards the past and the history of the field, and then where we are right now, and then you finished in an exciting way looking at future technologies. But what I really appreciated, Dr. Schwartz, was that not only did you go into the history of our field, but you shared a lot of your personal history. And I think that helped to make it such a gripping read and to really hammer home the emotion that we bring to our job every day, but also that you experienced at these different stages of your own personal development growing in the field. And uh, I just want to jump straight into the deep end, and I want to talk about the story you shared about your father and the role that you played in his care. Actually,
Yeah.
that was one of the most neurosurgical stories I've ever heard, and I just hats off to you for sharing that in such a compelling way. And I just wanted to highlight that for our audience. So please tell our audience about what happened with your dad when you were in training.
Sure. And your audience is many of whom are neurosurgeons will relate to this. We've all had family members who get sick, and obviously we're called upon to take care of them. And in my father's situation, a little background: he's a Freudian psychoanalyst. He's a very thoughtful, intellectual, sort of erudite man, and he goes in for a surgery on his duodenum. He has a benign tumor, and the surgery is uncomplicated. The surgeon comes out and says everything went great, and we all go home at the end of the day. And I think I'm like a PGY 6, maybe even a PGY 7 resident this time. And I'm at Columbia. He's having surgery at a different hospital, not where I work. And so I get a phone call in the morning, and I pick up the phone, and I hear a voice on the other end that sounds like my father, but he's having trouble speaking. And I recognize, the intonation of the voice, but I can't really make out what he's saying. And it's clear to me at that moment that he has a Broca's aphasia. I've heard of Broca's aphasia a million times, as a neurosurgery resident. And here my father's manifesting those symptoms. So it was almost that feeling. I remember, as a resident, when someone pages you and is like, your post-op patient is coding right now, or they're blowing a pupil, or there's some emergency. That was the feeling I had. Like, I jumped out of bed, I ran into the hospital, and I get to the hospital and my dad's just lying in bed. Like, there's nobody taking care of him. And he clearly has a new onset Broca's aphasia. And so I go to the nurse's station, and, I'm a resident, so I know how to get stuff done. I'm like, my dad needs a CAT scan right now. He needs a neurology consult. Like, let's go. So they give me the name of this neurologist, and they're like, yeah, we noticed he was having a little trouble with his speech. I'm like, no, 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 this is really bad. So I speak to the neurologist. I'm like, he needs a CAT scan right now. You got to order it. So he puts the order for CAT scan in, and I asked the nurse, where's CAT scan? And she goes, oh, it's on the 5th floor. So I go into my dad's room, and I do what I have done, hundreds of times as a neurosurgery resident, because I trained before there were transporters or when people got sick in the middle of the night. I took his IV bags, I threw him on the bed, I unlocked his bed, and I started wheeling him down the hall and into the elevator. And the nurse was like yelling at me, like, you can't do that. And I was gone. So I get up to the
Right.
5th floor, and I bring him to CAT scan, and I say, I'm Dr. Schwartz. This is my patient. I didn't happen to mention that I was not a doctor at that particular hospital, and said he needs a CAT scan right now. And I'm literally there moving him onto the stretcher, as you do as a resident. We all have done it in the middle of the night. But the really emotional moving part is, when you're sitting in the control room, as I do as an attending when I'm worried about a patient of mine, and you're just sitting there waiting for those images to come up. But when those images are coming up slice by slice, and what you're looking at is your dad's brain, and you're desperately, worried that you're going to see that black hole in the left frontal lobe where Broca's area is. And sure enough, the images come up and there's a big black hole right there. And so, I was the one to diagnose my dad with his stroke, which he got because he developed a hypercoagulable state because he had a lung cancer that no one knew about. And, he died a couple weeks later. But it was just a very emotional time for me and moment for me. And I think, you mentioned about the personal stories, and I just want to sort of do an aside. Like, there are a couple ways that I tried to make this book approachable to lay people. And I didn't want to originally make it a memoir. Like, my goal was not to say, I'm going to write a memoir, because there's so many great neurosurgical memoirs that tell stories about their patients. Like, I remember reading When the Air Hits Your Brain, or Jay Whelan's book, or
Mm.
Kalanithi's book, or even Henry Marsh's book, where they're talking about taking care of their patients. Those are such great books. But I realized that in order to tell this story well and make it gripping, I had to reveal a little bit about myself, and I had to talk about my own story, um, to try to make it more emotional. So it wasn't just a lecture about neurosurgery, but it was, really telling a story. And then the other technique, of course, was telling stories of celebrities and politicians and famous people who had brain surgery, and we can get there as well. That I thought the general public would be interested in, because they know those stories, but they don't really know what happened to those people and why what happened is important. And that I could use that as a jumping board to then talk about, well, who was the first neurosurgeon to ever do this, or why do we do this, and then bring the history in, kind of pepper it in, throughout the book.
Mm.
Ted, and I'm sorry to hear that story about your father. It's terrible. What a great loss, especially for such a brilliant man, right? To have a stroke first with that. Um, you know, as neurosurgeons read this, I've had a chance to talk to a lot of my friends who've had a chance to look it over. And, what strikes me is that most, or maybe even all neurosurgeons have in their, as you said, in their biography, these types of stories, right? But what makes your book different is your ability to tell the story. And I want to go in a little bit about how you developed that skill. Was this something special in your childhood? Was it the time at Harvard? Like, how did you become such a great storyteller? Because almost any neurosurgeon, and I'm not, by the way, diminishing this book in any way, has this catalog of interesting cases, right? We've even
Yeah,
done
no,
podcasts.
any one of us could write a book. It would be fascinating. There's no question about that.
But how did you become such a great storyteller? This is not part of our training, right? Most
Yeah.
neurosurgeons are horrible storytellers.
So, I came to neurosurgery through somewhat of an unusual path, which is that I did not grow up wanting to be a brain surgeon. I grew up in a household with a father who was a Freudian psychoanalyst, a mother who was a Holocaust survivor, talking about, a lot of very intellectual, deep, thoughtful, emotional concepts. And I at Harvard majored in philosophy and English. So I was reading a lot you know, about philosophy, but good philosophers tell stories. Like if you read the original works of Freud, like he would present cases in a way that were these gripping stories about the patients he was taking care of. And so um, I think reading and writing has always been a big part of my life. I'm constantly reading and writing. I remember, being on call when I would be on, covering a hospital, St. Barnabas in the Bronx, level one trauma center when I first started out, and I have to drive out there every night at, 2 in the morning and suck out a subdural. The way I dealt with that, the burden of doing that at 2 in the morning was I would put a book on tape and I would listen to books as I would drive in and out of the hospital, which would soothe me, because it would take me on a trip somewhere else and sort of not make me feel so resentful that I was, exhausted and, losing my personal life to the field of neurosurgery. Um, so I don't know. I guess I think it was just the way I was raised. I've always been a reader and a writer, and I actually also what drew me to neurosurgery was I was interested in how language was organized in the brain. That was really
Mm.
the question that got me excited about neurosurgery. I read a paper by George Ogerman who did awake language mapping in bilingual patients, and because I was interested in philosophy and philosophy of language, and he showed that he could stimulate the brain in one area and interrupt the ability to speak one language and not another. And to me, that was the most incredible thing, that you could actually use the neurosurgical operating room as a laboratory, and you could take your patients who are awake in the operating room and try to figure out how the brain works and what consciousness is, and how language is organized. And that's why I spent a year with George, which was a seminal year for me that got me so interested in neurosurgery. And I think I've always been interested in those kinds of questions. Obviously, I joked, I spoke at George's retirement, and I started out interested in how the brain works, and now what I mostly do is I go up people's nose and like suck boogers out of their nose and suck tumors out of their noses. So it's not exactly investigating the origins of consciousness, what we do day to day, but obviously I love doing that as well, and it's just so rewarding.
Yeah, it's fascinating to hear you talk about your background, because one of the other things I wanted to ask you about, in addition to that personal history and that time in your training that you shared, and these stories, which, as you say, we all have these crazy cases because we're dealing with the brain. We deal with emergencies in the middle of the night. There's an inherent drama to these things, and a lot of the stories that you shared from your training deal with some of your mentors. Obviously, speaking about your father, your mother, who had an incredible story that you also talked about. There was a surgeon. I wrote down a great line you had in the book from a Dr. Paul Russell, who was a transplant surgeon at Mass General, and you wrote, "Ted, he said it's simple. If you want people to depend on you, you have to be dependable." That is such a surgical piece of advice. It's like the three A's of a good consultant. But much like we have those cases we carry around with us, we also have that cadre of mentors who are always on our shoulders and whispering in our ears when we operate. But if I can flip this on you, I wonder if you have anyone you would call a literary mentor, either who, when you were young or in school, who actually taught you writing and some of the creative side, or even, I dabble in creative writing from time to time, and there are authors who I'll try to mimic. I'll see the way they turn a phrase and kind of put that in my toolkit, just like we do in surgery. So, are there any people who coached you creatively in writing, or any authors that you consider strong influences?
Not in particular. I was a big science fiction fan when I was a kid. I read a ton of science fiction. In fact, Another story about that, like I remember going on vacation with my parents, and we were in a car driving through the West. You're seeing the Grand Canyon and Bryce and Zion. And I was in the back seat of the car reading science fiction books. And my parents were so mad at me. They were like, "Will you take your head out of the book and just look out the window for a second? Because, this is some of the most magnificent landscape, on the planet." And I was reading a book. Um, so I've been reading Immortal's books. I don't know if you know him, A Gentleman in Moscow on the Lincoln Highway. I think he's a fantastic writer. Um, I can't say there's any one person. I never really studied writing. I never, you know, uh, studied creative writing. I never did that much creative writing. I write a lot of papers. I do
Yeah.
enjoy writing and editing, but it's a very different kind of writing. But I think the writing that we do, what's helpful about it is like I'm very comfortable waking up at 5 in the morning on Saturday morning, getting a cup of coffee and sitting at my computer for 6 hours and writing a grant or rewriting, editing papers that I'm working on with my residents. And so part of the issue with writing that people have is the discipline to actually sit down and write. Everyone
Mm.
says, "Oh, I'm working on my novel. I want to write a novel. I have this book I want to write." Um, but the hard part is having the dedication, the focus, and the discipline to do that. But we're really good at that in neurosurgery. Like we
Yeah.
know how to get up and get shit done because we train to do that. And so it's that same skill set. I just woke up every morning at 5 in the morning and just started plowing through this. The other funny story, I want to tell a story that I actually have never told before, which was one of the motivations that got me to write this book. And I thought I would tell it here because as neurosurgeons, you'd appreciate it. So um, before I wrote the book, I interviewed to be the editor of the Red Journal. I was one of the people asked to interview. And it was a huge honor, and I really prepared hard for it. And I thought about it, and I thought it would be an incredible experience to do it. And I gave my presentation, and I didn't get it, obviously. And everyone who interviewed was super qualified, and obviously Doug's fantastic and is doing an incredible job. But at the end of it, when I didn't get it, I called up one of my friends who was on the board, and I said, "Hey, just give me some feedback." Because all they say is, "Well, thank you very much, but you're not moving on to the next stage." I said, "Give me a little feedback. What was the criticism? Like, what did people think?" And they said, "You know what? Everyone loved your presentation. They thought you do a fantastic job, but they thought you were too clinically busy and that you wouldn't have the time to do the job." And I thought about that for a while, and I was like, they don't think I have the time to do the job. You know what? I'm going to write a book. And part of it was this motivation of like, I'm going to show those guys who are underestimating my ability to do this job and prove to them that I have the time. Now, obviously, I didn't just write this book as a spite book. The book is a love letter to neurosurgery, and I loved writing it, and I love writing. But that was one little extra thing that said to me, "Hey, you know what? Just put in the time, put in the effort, get it done. Show the world that you have the time to do this while you're doing however many cases you're doing, that you can add a little more to your plate."
Wow, that's fantastic. I remember that process. Michael Puzo would talk about how you were the perfect person to edit the Red Journal, and he always spoke so highly of your surgical skill. And as you know, you've saved lives of friends of mine, and they are forever indebted to you personally and professionally. So, Ted, I mean, for anybody who doesn't know who um, you are the true triple threat. I mean, you encompass all of the top level neurosurgical traits. So I want to ask you about that. And I love that you throw in the history. Like you talk about some elements of history that get forgotten. Of course, we talk about Cushing, but you talk about Alexa Kennedy, you talk about Ben Carson, you talk about some elements that I worry is going to be lost. And when I look at the neurosurgery phenotype, right, whatever that means, it's evolving. But as I talk to a lot of the applicants, the young surgeons, our own residents, I'm actually a little bit shocked at their lack of knowledge about the history of our field. And I mean fairly basic stuff, a lot of it covered in this book, right? And so I'm going to encourage them, please, all Miami residents and fellows need to read Gray Matters. I expect it read by the end of the week. Uh, and the thing is, like, it's such an important part of that phenotype of who we are. I worry, are we all just too preoccupied with something different? And if we lose that historical piece, and this is why I love your book so much, do we lose like a piece of who we are, or do you think we can go on without any basis and foundation in the past?
No, I mean, obviously, the reason I wrote it was I wasn't thinking as much about neurosurgical trainees because I almost assumed that they did know who these people were. But I was amazed that the general public does not know who Cushing was, who Dandy was, who Penfield was, who Yasher Gill is. I mean, if you think about the impact that these individuals had on millions and millions and millions of lives, because of the field that they created and helped us create. I wanted people to come away at least knowing those four names, because obviously there's so many great neurosurgeons in the world. And I was like, oh my God, if I leave this one out, I leave this one out, So I narrowed it down. I boiled it down to the sort of the four people I thought were the most important people to know, and those were those names. And yeah, I think if there are trainees who don't know who those people are, they absolutely should, and hopefully will inspire them to read the real biographies. Like Bliss's biography of Cushing is incredible. It's a huge book because there's just so much depth to it, and I just had to kind of water it down and distill it into a couple of facts. But where we came from is incredibly important because when you realize, um, Cushing, for example, when he started out, the mortality of neurosurgery was 50%. Half the patients that were operated on would die either like immediately post-op or in the operating room. And the fortitude it must have taken him to go from that to bring it down to 8%, is incredible. And like the amount of patients he must have lost in his first couple of years and how devastating. I mean, think of one of us, if you lose a patient, I mean, you think about it every day for months and you never forget about it. And he's going through, patient after patient after patient that he's hurting. um, and then you think of all the revolutions that came in, the microscope revolution, and the stereotactic revolution, all the things that brought us where we are today, because it also makes you realize, oh my God, like where we're going to be in 20 years. Like you can't even imagine it. You can't even imagine it. I mean, I was lucky enough in my lifetime to be one of the early adopters of the endoscope, right, for this endonasal surgery, and fight all these battles of people saying, oh, you can't take out tumors that way. You shouldn't use an endoscope. And in my short career, which 25 years or something, everybody's using endoscopes through the nose. Like it's not a crazy far-fetched thing. That was a complete revolution that occurred within one generation. And we all know that in everything that we do. I'm sure, Mike, your spine surgeries now are just so much different than the way you learned how to do them. And I wanted to capture that sense of like every couple of years, there's another revolution that just transforms our field.
That is very interesting. I mean, to your point about these giants who impacted so many lives, not only developing techniques and the people they trained, but the far-reaching effects of uh, the impact they had on our field and how it reaches out throughout lives and society. I mean, I was on a car ride recently with someone who works in the medical field, but by no means knows anything about neurosurgery. Harvey Cushing came up, didn't know who Harvey Cushing was. So I just casually started listing off the top of my head the things that he accomplished or invented to a point where I forgot some and went back and I went, oh yeah, and also he brought the sphygmomanometer to North America. Oh yeah, and the anesthesia record, he just came up with that. I was forgetting things. He invented so many general medical tools and tricks and concepts, and the person I was with just went, what? Huh? It's astonishing that any I mean people that work in healthcare don't know his name. Um, but at the risk of uh, tapping the well, which I don't think is possible here, because as we've said several times, the number of stories shared in this book, both personal and historical, we could sit here for hours and not cover them all. But there is one more that I do want to share and hear straight from the source for our listeners. So Dr. Wang and I just wrapped up a series we did that covered a couple months on this show talking about good and evil, as it applies to our work in neurosurgery and in our broader lives as men. And one of the things that we always come back to, both in that series and in many of our conversations on the show about how to be and how to comport ourselves professionally in neurosurgery, is about honesty. And there was a story that, again, much like with your parents' stories, just hats off. I was very impressed that you shared this story for such a public audience about, again, I think you were in your intern year and there was a potassium chloride dose
Yeah.
that went awry. And I was blown away, both the fact that that happened, because I could perfectly imagine being in your position, and that sinking cold feeling you must have had. I'm
Yeah.
close enough that I can remember that. Then the fact that you shared it, and again, how grippingly you told it. So please share that, especially for some of our younger listeners, about the value of speaking up and telling the truth.
Yeah, so I was an intern. I was up at Columbia, which is where I did my residency training, and I was called to a code. Um, and I was obviously not leading the code because there was a senior resident leading the code, and the senior resident wanted to push medication through the IV, and so she, sort of yelled out to me, "Hey Ted, can you get me some sodium chloride so I can flush the medication?" So I ran to the closet. There was a closet you would go to that would have all of the supplies, and this was a while ago. I mean, it was maybe whatever 30 years ago, and there were two cardboard boxes next to each other with small vials in them. And one cardboard box, had pink tops and the other had green tops, and they were sort of scattered about because people would grab them and they would like throw them back down. They would grab one and like four of them would fall out, and it was, there was saran wrap on the, not saran wrap, yeah, the clear plastic saran wrap keeping them in place that was torn. And so I just ran and grabbed a bottle and I ran back, and they were right next to each other, these two boxes. So I give her the flush, and she pulls it out and she flushes it, and the woman who's coding but is still conscious looks up for a second and says, "Oh my," and just slumps forward. And I look down at my hand and I see that the bottle says potassium chloride, not sodium chloride. And potassium chloride is one of the three drugs we give for lethal injections because it stops the heart. So I had inadvertently given the wrong drug to the senior resident. And the second you look at it, you think like, "Oh my God, what did I do? What's the liability of what I did? What am I supposed to do now?" Um, and I decided very, very quickly. I ran over to the senior resident. I said to her, "Hey, I just gave you this potassium chloride. Like I just told the truth. Be honest. This is what happened. This is what I did." And she looked at me and she said, "Thank you for telling me that. Whatever you do not tell anyone else what you just told me." And she turned around and saved the patient's life. And it was such a pivotal moment for me
Mhm.
and something I'll never forget. And one lesson that I have kept true always is that whenever you have a crisis at a moment and there's like a patient with an infection or something, and you're worried about, oh, what's it going to look like at M&M when I have another infection? The right thing to do for most of the time, if you cut through all the bullshit, is do the right thing for the patient. Always do the right thing for the patient, and everything else will sort itself out. And if you always put that as your first priority, that what's going to push me to make the right decision at any moment in time is doing absolutely the best thing for the patient I'm taking care of, everything else will sort itself out in the end. And that was the way I learned that lesson. And thank God that patient was resuscitated and did well. And then when I was researching the book and writing it, I was thinking to myself, like, am I the only one who ever made this mistake? Like, is this a common mistake? And I learned that in England, they had a whole committee that was set up to make hospitals safer. And one of the first things they did was they took potassium chloride vials and they put them under lock and key so that you cannot get them. They don't leave them out because it was so common for people to accidentally give potassium chloride instead of sodium chloride because they were lying literally right next to each other. They look identical, except one has a pink top and one had a green top. So it was I called it a trap that was inadvertently set for me by the institution. It was sort of a systemic problem that they needed to address, just like medication errors. Like you need an alert on the computer that tells you if you're about to give two medications that are going to interact with each other. Hospitals now are safer and safer because of that.
Yeah, it's very interesting. I mean, you've probably followed that case last year, the Vanderbilt nurse with the with the case in the MRI scanner. Also neurosurgery, by the way. That was a neurosurgery patient getting a follow-up MRI after subdural. It is such an important issue to highlight that these errors can happen and they can happen quite quickly. But this book, I'm going to tell you, 480 odd pages of pure gold. Um, I had a chance to look at some of the reviews, okay, and I'm just going to say, like, okay, Wall Street Journal, okay, stamina and focus are the true superpowers required of neurosurgeons. Their tools are less critical than the minds in control of them. Okay, what I see here is I see what this is one of the important things Harvey Cushing did, right? To recapture America's imagination or the world's imagination about what it is that we do and why the sacrifice is so important. Ted, your imprint on our field is so big. I was at NASS, North American Spine Society. I walk in the exhibit hall, and there's your picture, book signing. I'm like, this is a spine meeting. What is going on here? And they're like, no. Do you know Dr. Schwartz? He's famous. He's got these instruments. Like, I know Ted Schwartz, but he's not a spine surgeon. And I just missed you. I would have gotten the book signed. I mean, the impact on the public's view of who we are, and you mention it in the book that a short segment on Chris Dunch, right? And you probably know that was the inspiration of the Neurosurgery podcast, that we wanted
Oh,
the
I didn't
world
know
to
that.
see us. Oh yeah. We started this because of the Dr. Death podcast. We said the
Wow.
world cannot think that we are like that, because we are not like that. There are a few.
Right.
Um,
And I talk about, by the way, the myth of the neurosurgeon, right? That's so one of the threads when you write a book, right? You have to have threads that run through the book. You have to tell a story. And one of the stories are what are the myths of the neurosurgeon and what's the reality? And there's two myths if you think about it. When I thought about it, one myth is sort of it's not brain surgery, that we're sort of these brilliant Renaissance men. And I say, well, that really comes back to Harvey Cushing. And there are some role models in Hollywood, because obviously Hollywood is what perpetuates all the mythology of America and our culture, like Buckaroo Banzai and Dr. Strange. But then the other myth is the mad scientist, and it's the sociopath. It's the crazy person who is trying to take advantage of patients, like in Get Out, doing brain transplants, or Hannibal Lecter, or Christopher Dunch. And that captures the public's imagination and their fear that they're going to go under anesthesia and we're going to mess with their brains, right? They're worried about that. And I started to think about, like, where does that come from? Like, why they think we're mad scientists? And I realized it's probably because of the frontal lobotomy. And the frontal lobotomy was an operation that I learned nothing about. And I trained 30 years ago. Like, nobody's learning about what the frontal lobotomy is right now. And I sort of, as a psychoanalyst's son, I was thinking to myself, wow, this is like a skeleton in the closet of neurosurgery that we've all repressed for all these years. I want to investigate what this is. And I want to figure out, were neurosurgeons complicit? Like, did we embrace the frontal lobotomy as a great treatment, or were we more reluctant in our adoption of frontal lobotomies? And what I found out is most of the frontal lobotomy was really introduced to the world by psychiatrists for the most part, and neurologists. We all know Walter Freeman, who did the ice pick lobotomy, and talk about that. And the neurosurgeons who did it studied it. They studied it very carefully. They did randomized controlled studies, and I present that data and what it showed. One of the really fascinating things I learned about the frontal lobotomy is that there were a bunch of people who actually got better from it. Who clearly benefited from the frontal lobotomy. Many were hurt, and the risks, outweighed the benefits. But there's clearly was a subset where the people who wrote these papers were like, I'm not sure why, but this person is much better than they were before. And here's like they would have psychiatrists blinded as to whether people had lobotomies or didn't have lobotomies, and they would examine them, and many got better. And it also propelled neurosurgery because stereotaxis and electrodes in the brain were all developed by people trying to improve on the frontal lobotomy. They just wanted to make it better. Radiosurgery, things like that, all came out of the frontal lobotomy. So it was a very important turning point for our field, but it also created that myth that we see reverberating through our culture, that somehow neurosurgeons may be up to no good every once in a while.
Well, I'd rather have a bottle in front of me than a frontal lobotomy personally, but
Well said, JP. What are we
it was
drinking?
there. It was there. Had to be said. Well, Dr. Schwartz, we're so grateful that you came back on the show. I think the first time we had you on was way back in our series covering the events of COVID and the experience in our different hospitals around the country a few years back. So it's been too long, and it's great to speak with you again on this, our first remote video episode. So thank you for breaking ground with us on that. Um, we can't stop talking about this book. We could sit here for hours and delve into the stories. Gray Matters by Dr. Ted Schwartz. There it is. We'll link to the book on Amazon, wherever you can find it. I do want to point to our listeners that Dr. Schwartz, before this, just a few weeks ago, was on the Michael Shermer show. Michael Shermer, one of the founders and previously the editor-in-chief of The Skeptic magazine. He has a podcast now where he has all sorts of leading intellectuals from around the world on that show. He's a great interviewer, and as that's obviously for a different audience than our show here, you and he go out into the weeds on some of the philosophy and the cognitive philosophy of the brain's function in neurosurgery. And I would really point all of our listeners to that interview as well. We tried not to overlap some of the stuff that you covered with him, but that was a great talk. And then, most importantly for me, I had no idea you were a science fiction guy. So you're going on my list now. I'm a sci-fi nut. One of
Love it.
these days, we're going to do an episode about science fiction in neurosurgery. Buckaroo Banzai will be discussed. Mark Shaffrey has a huge collection of first edition science fiction prints. So I'm slowly forming a rogues gallery of science fiction neurosurgeons.
Put me in the group. Put me in the group. I'm in. I'm in.
Yeah,
I'm a
perfect.
huge fan of what you guys do, by the way. I love the podcast. Big, big fan. You guys are great.
Well, we appreciate that very much. So, Gray Matters is the title. It's an exhilarating read for anyone in the field or otherwise. Dr. Schwartz, thank you so much for coming on the show to talk with us about your book.
Thanks for having me.